Hello, I'm Dr. Abhisek Ghosh, consultant physician at Kolkata, practicing at Baguiati, Nagarjuna region. So I am here to discuss with you about the few important information about a very common disease, that is the acid peptic disease disorders. That is mostly I shall tell about the diagnosing acidity and acid peptic disorders, which are actually the one of the most common symptoms and disease for which patients come to the doctor's OPD clinic, as well as sometimes patient may need admission also. But actually, it is a common problem across the ages, and most commonly it is a problem of the middle-aged persons. So acid peptic disease patient actually can ignore serious conditions like heart condition, also acid peptic disease. That is should be done definitely. But acid peptic disease is actually very easy to diagnose, and we shall discuss about the few tips. So diagnosing acidity and acid peptic disorders involves a combination of the clinical evaluation, diagnostic test, and of course medical history assessment. So understanding the diagnostic process can help to individualize the help how the individuals to receive the proper treatment at the appropriate time, so that further delay actually can worsen the condition, and sometimes ulcer can happen, peptic ulcer, which is actually sometimes that can cause significant problem and that may take time to heal. So medical history assessment, healthcare providers begin by gathering a comprehensive medical history, including the information about the symptoms. Mostly patient can complain of chest pain, sometimes some bitter taste in the mouth, some acid reflux, and patient often feel that his abdomen can be bloated, and also there is a less desire to take the food. And most commonly symptoms actually can aggravate after the food intake or may appear sometimes in the more in the stomach. So you have to identify the symptoms. We have to identify, ask about the patient's how long patient is suffering, that is duration, and what is the severity, how much the frequency of the symptoms per day, whether there is some nocturnal nighttime awakening of this patient due to these symptoms, whether it is present or not. And also we have to identify the factors which can worsen or alleviate the acidity. So sometimes patients we have to ask the patient whether what is the food intake pattern, whether patient takes dinner at very late night, and whether patient takes some tea, coffee, chocolate at the late night, or how long is what is the gap between the dinner and the sleeping time. Actually all actually impacts the acidity, and we have to prevent that and appropriately guide them that avoiding too much chocolate, cold drinks, and coffee, tea at the night can actually increase the symptoms. And there should be a gap between at least 1 hour gap between food intake and the sleeping time. Food, and also they should make their head in a little bit to prevent the acid reflux. So these are the lifestyle measures we have to follow. And also the patient must avoid the spicy food intake. So patients are asked about their dietary habits, lifestyle factors, medication use, and any underlying medical conditions that may contribute to the acid peptic disorder. So after this history, we have to go to physical examination. The physical examination may be performed to assess for signs of the acid-related complications such as epigastric tenderness, abdominal bloating. Epigastric means just below the chest. We have to find the tenderness, like that means whether it is patient feels pain when you are touching that. So epigastric area is it is the uppermost part of the abdomen, whether it is tender or not. Abdominal bloating, that means also a patient always feels that his abdominal is full. That's why he is less desired or to get food, and that's why often there is a long gap between food intake, which actually can aggravate the acidity. Or often patients are not taking the food appropriate time. There's long gap. But often we can get the signs of malnutrition, which is most commonly can be seen in the mouth ulcer because of some vitamin deficiency, and also can be some malnutrition, which there can be muscle bulk can be poor due to protein malnutrition. So these are the signs which you can I have to identify and assess the patient's severity and the appropriately giving the proper management. So examination of the oral cavity is essential, and to see whether there is any ulcer present in the mouth or any oral cavity. Also, we have to assess the throat and abdomen to may provide the valuable clues to the presence of acid reflux or peptic ulcer disease. Often patients complain of cough, and that is a sign of the acid reflux. So we often dry cough present for a long time. Patient is not improving with the anti-cough medications. So of course, acid peptic disorders should be a differential diagnosis, and we have to consider giving acid suppressive agents for their cure. And of course, we have to assess the abdomen whether patient is this acidity is purely due to gastric problem, their stomach problem, or sometimes concomitant gallbladder disease, fatty liver disease that also sometimes aggravate the symptoms. So we have to assess clinically whether these conditions are also simultaneously present or not. And this actually provides important clue to us. So there are some diagnostic tests are available, and not all patients require diagnostic tests. When diagnosis is very certain, then we can start treatment straight away. But sometimes to confirm the diagnosis, we require some tests. Most commonly is upper GI endoscopy, which is the cornerstone of the investigations, and it involves actually insert a flexible tube, and a catheter is attached to that tube, and some pain relieving gel like anesthetic gel is given along with this tube to prevent the pain, and the patient is asked to swallow that. So this tube goes into the esophagus, that is the uppermost part of our food pipe, then to stomach, and also may go to duodenum, to the upper part of the small intestine, and that visualize the gastrointestinal tract, and that can identify any abnormalities such as esophagitis if it is problem in the esophagus, whether it is gastritis that is problem in the stomach, or it can sometimes identify the peptic ulcer. Peptic ulcer can be, if it is present in the stomach, then we call it as gastric ulcer. If it is present in the duodenum, we call it duodenal ulcer. So symptoms may all be almost same, but duodenal ulcer pain is actually common in the empty stomach. Peptic ulcer pain is common after taking meal. But we can confirm this diagnosis of whether it is gastritis stage or esophagitis state or whether it is ulcer state by endoscopy only, because symptoms often may be same, more serious, and it will take long time to treat, and often it requires antibiotic therapy to treat. After this esophageal diagnosis, upper GI endoscopy, we have the option of other tests also, like esophageal pH monitoring. This actually measures the acidity levels in esophagus over time, and also to evaluate the acid reflux episodes and assess the severity of the gastroesophageal reflux disease. So the gastroesophageal reflux disease, that means stomach content is actually going up, especially when we lie down. That going up, that is called reflux, and that actually can cause cough as well as some bitter taste in the mouth. There is some presence of some burning sensation in our chest. So that for this, we the option of esophageal pH monitoring, and that confirm the GERD, that is the gastroesophageal reflux disease, so which is another common form of the acid peptic disorder. Next, barium swallow. So patients here swallow a barium solution that coats the cause the coating and in this inside the esophagus and also the stomach, and that allows the visualization of the structural abnormalities in the esophagus and stomach, or maybe the reflux symptoms on X-ray imaging. So here particular dye is given, and we take the X-ray after that to identify whether there is any structural abnormalities present or not, whether there is any abnormal narrowing present or not, or abnormal tumor present or not, like that. Also, you have ambulatory pH monitoring. It involves wearing a small device that measures pH level in the esophagus for over 24 to 48 hours. It provides a more comprehensive assessment of the acid reflux patients and symptom correlation. And of course, we have the option of blood test. It may be performed to assess the presence of Helicobacter pylori infection, that is a common cause of the peptic ulcer. This is a bacteria infection, and we find these by blood test, and often, of course, and sometimes it can be done by during the endoscopy also. If this Helicobacter pylori is present, then we have to give antibiotic therapy to control the acid peptic disorder symptoms. So these are the diagnostic tests which are commonly do in the patients having presenting with such symptoms of chest pain, heartburn, bitter taste in the mouth, bloating sensation in the abdomen, not taking enough food because of loss of appetite. So these are the symptoms, and we have to be very cautious and do the appropriate tests to start the treatment. So we can do trial of the empirical therapy. Empirical therapy means when you are pretty much sure about the diagnosis, and we, without the help of any diagnosis test, also we can start therapy, that is called empirical therapy. So in some cases, healthcare providers may recommend a trial of empirical therapy, especially with the proton pump inhibitors like pantoprazole, omeprazole, esomeprazole, multiple drugs are there, ariprazole are there. And of course, in milder cases, we can give histamine 2 type receptor antagonists, that is the ranitidine, famotidine, etc. That can alleviate the symptom and assess the response to treatment. So whether the empirical treatment we start, and we assess the symptoms after the follow-up visit of the patient, that whether the patient is improving or not. If he is improving, then we can continue the same therapy for at least 8 to 12 weeks. But sometimes patient may not respond, and then it is time to refer to the specialist. So depending on the complexity of the cases, patient may be referred to the gastroenterologists or specialist in gastrointestinal motility disorders for further evaluation and management. So by undergoing a thorough diagnostic evaluation, individuals with acidity and acid peptic disorders can receive targeted treatment tailored to their specific needs, leading to improved symptom control and better overall quality of life. So, what are the indications of this severity of this disease? That when we did specialist therapy, of course, definitely not improving the symptoms adequately, or frequency of the symptom is significantly high, and if there is weight loss, if there is some obstructive symptoms present, chest, like patient is having some breathlessness after swallowing. So, and also if there is some history of some bleeding, either from the mouth or with the stool. So these are the dangerous sign: weight loss, some compressive symptoms, bleeding. So that indicates if this ulcer is in some severe stage, and we have to give proper management, appropriate promptly, and sometimes patient may require admission also to prevent the bleeding. Sometimes the endoscopy once again is used to control the bleeding, because that will actually burn the bleeding vessels. So these are the, in simple words, about the acid peptic disorders. But of course, lifestyle plays a very key role. We have to avoid smoking, definitely, because that aggravates the pain and also the secretion. We have to avoid the alcohol as far as possible. Better to avoid completely, because alcohol-induced peptic ulcer is also very common. And definitely appropriate food intake. Avoid too much spicy food, too much fatty food, especially at the night, dairy products, coffee, chocolate at the night. That actually prevent the that actually worsen the symptoms. And of course, timely intake of the food. Do not delay your breakfast too long, because early breakfast actually can help you to prevent your acid secretion in excess, and that can prevent the acid peptic disorders. So acid peptic disorders, though very common symptoms, but often it is neglected by the patient, and sometimes the patient take 5 to 7 days therapy, and symptoms may go away, but after that they return. So it is better to continue the therapy for a long time, at least to 8 to 12 weeks, to control the symptoms in a better way. And sometimes patients require longer therapy that will actually not should not be by self-medication, but actually on the specialist advice, that whether to continue the therapy for beyond the 12 weeks or not. And sometimes patients are afraid of taking the medicine for a long time, thinking that there is some secretion of the kidney problem, osteoporosis, etc. But actually, there is very negligible risk. If it is present in used in very high dose, inappropriate high dose for very long years, then only there can be symptoms. But taking this medicine for 2 to 3 months, actually, that doesn't cause any significant problem. These are quite safe drug, effective drug, and but must be with the advice of the doctors. And after these medicines, we have to take the proper breakfast. Without taking the drug, do not take the breakfast, actually will not much help, because these medicines are active only when your acid secretion in the stomach is in higher level, and that is actually higher level when you take the food at appropriate time. So stay well and enjoy your life. And any symptoms appear, do not self-prescribe. Consult your doctor. Disorders. Thank you.